Hi, beautiful people. How are ya? I hope you're having a great day. So I was reading an article, Mayo Clinic Proceedings, and the writers stated that there is a distinction between central neuropathic pain and central sensitization. Amen to that. That makes sense. And so in this article that I was reading, it says that we should not confuse central sensitization with central neuropathic pain. So here's what I believe that I've been able to pull together so far. I think this will help us to understand a little better. At least it's helping me. CPS, central pain syndrome, can have a neuropathic origin in which the pain results from a central nervous system injury like in MS or stroke, or it can have a central sensitization origin like with fibromyalgia. Now that makes sense. It can have different origins. The criteria for a fibromyalgia diagnosis overlaps considerably with CPS, central pain syndrome diagnosis. Those who report severe fatigue have 5 times more widespread pain with CPS. To diagnose CPS, the pain must have lasted for 3 months or more with widespread allodynia or hyperalgesia. And according to the Cleveland Clinic, allodynia is a type of neuropathic pain that makes people extremely sensitive to touch, like diabetes, shingles, fibromyalgia, and migraine headaches. I think my oldest granddaughter, has problems with allodynia because of her migraines. When she's got a migraine, she cannot stand to be touched anywhere at all. She'll freak out. But did you catch it that allodynia is a type of neuropathic pain? Nerve pain. That makes sense to me. People with fibromyalgia have this type of nerve pain too. Hyperalgesia is a symptom where you feel pain in situations where the feeling is normal or should be normal, but the pain is more severe than it should be. The body's pain processes are disrupted and considered the cause of it. This would be like touching a burned area on the skin. And yeah, that would hurt, but it would feel excruciating to the point of probably screaming. It should be painful, but not to that extent. When my fibromyalgia was coming on, I've shared this story before, but for those of you who are new, I went to my doctor because my hips hurt, the sides of my legs hurt. It was down my legs into my feet, but my hips was my concern. And my doctor had me stand in front of him and turn around so I couldn't see what he was doing. And he just barely touched my hips with a soft, gentle touch. And I screamed, which made me cry because I was so embarrassed that I did that. Well, that's hyperalgesia. It's an abnormal pain symptom. Centralized pain is either generalized, meaning all over the body, like in fibro, or in multiple site locations in the body, just specific areas, or in a specific area. In addition, a person may experience mood changes, fatigue, cognitive disturbances, sleep changes, and neuropathic pain symptoms like burning, numbness, tingling, and paresthesias. Anxiety and depression are also common. And there will be issues with extreme temperatures, especially cold, or loud sounds are extremely painful. But to be diagnosed with central pain syndrome, the pain must be on both sides of the body, generally. That's what one site says. So widespread above and below the diaphragm, but also I've read that the pain can affect a large proportion of the body or can be restricted to specific areas like the hands or feet. I think that would be more likely. Laboratory workup is usually normal unless there is an underlying autoimmune condition. The extent of the pain is usually related to the cause of the central nervous system injury or damage. The pain is usually moderate to severe in intensity and is often made worse by touch, movement, emotions, temperature changes. Like I said, cold temps usually. And there are environmental and genetic components to developing CPS. Just like how fibro can have overlapping conditions like RA, lupus, or MS, it's also common to have centralized pain syndrome with fibromyalgia. In the general, fibromyalgia will cause the centralized pain. In the general population, 5 to 15% of people with CPS have fibro. People who have had a stroke, have MS, tumors, or epilepsy, have a brain or spinal cord trauma or Parkinson's disease can trigger the onset of central pain syndrome. People with osteoarthritis, rheumatoid arthritis, back pain from muscle strains, nerve compression, or arthritis of the spine, aka spinal stenosis. Fibromyalgia, inflammatory bowel disease, surgical trauma, or advanced cancer can cause CPS. So central pain syndrome is a neuropathic pain in the central nervous system. It can occur in patients following a stroke or with multiple sclerosis. When any acute pain becomes chronic, it can undergo centralization, putting patients at risk for developing central pain syndrome. The prognosis depends on the underlying disease state that initially causes CPS and if it can be cured, corrected, or managed. Adults older than 65 are prone to all kinds of conditions that can produce chronic pain. And then central pain syndrome. Central pain syndrome often has an identifiable trigger like arthritis or an injury from a broken bone that maybe doesn't heal properly. Fibromyalgia often arises without a known cause. Unfortunately, as we've kind of learned, there are multiple, many different causes potentially. So if you're wondering if you may have CPS with your fibro, talk to your doctor. Since there's usually a known trigger or one that can be identified, your doctor may order an MRI, an X-ray, or blood work to determine if your pain is stemming from another condition. There is help for this condition normally. Medications, physical therapy, nerve blocks can help. Psychological therapy may help with mood. Alternative therapies may be yoga or acupuncture. And like with fibro, we learn to cope with our illnesses by focusing on the positive in our life. We remain engaged with our family and friends and do activities we enjoy. We may participate in online support groups because they're very helpful. But treatment of a comorbid disease alongside centralized pain can improve a patient's pain. Like antidepressants and anticonvulsants are common treatments for CPS, like in fibro. NSAIDs and opioids are not helpful. So I'd love to hear from you. Do you have central pain syndrome with your fibromyalgia? I hope you learned something. I send you gentle hugs and support. Love you. Oh my goodness, I'm not sure where that stopped. Centralized pain can improve. Clock is ticking.